really changed. Those eyes.
Yeah. You want to play while we talk for a minute? You want to play with your truck?
Let me see, I have some.
Dad wants to be called because
Okay.
he can't be here, so.
Yeah. Oh, you gonna just call him?
Yeah, I can just call him.
Absolutely. Go ahead. We need to call Amy too.
Hey Mom, my name is Dr. Haddad. I'm the gastroenterologist.
Hi. Oh, you guys haven't met.
No. Hey, you're cute.
See, this is
You're
Ola.
very cute. Okay, let me see.
Yeah, okay. You want to play truck?
Here.
What am I doing? Calling you.
Calling Amy. And I'll have a seat back here.
You want to play cars? You want to play
Obe?
cars?
Is that how he goes by? Obe?
Oba.
Oba.
Hey.
You got
Good
it.
on. Hello? I'm just.
Hey,
letting him
Amy,
call me.
we're
I'll put you on speaker.
I'm with Kim and Oba, so I'm gonna put you somewhere.
Oh, wait. No.
Okay, you can use my phones or whatever.
Here, tell me if you don't hear.
He still throws up, like I was telling y'all last time I came for when he threw up the tube. He throws up, if not every day, every other day. It's between the second or the third feeding. Yeah, like I was saying before, he still throws it up. I don't.
What's his regimen? Because I don't know what his feeding regimen.
let's go. Is this what you're putting in the tube?
Yes.
Okay,
He
so-
won't drink it.
What's he getting in the tube?
He gets this Pediasure right here. Pediasure Peptide 1.0.
Okay.
I brought it with me so you guys can see it. It is, as I was saying before, it's short on his calorie intake as well for the medical paperwork it says.
Especially with him throwing up.
And especially with him throwing up, he's gonna not get that, what he's supposed to.
Right, exactly.
It's 237 calories, if that, you can write it down if you want to.
Is that just Kim in there?
So, no, it's Kim and
Dr. Haddad. I'm
Dr.
the
Haddad. We're just
gastroenterologist.
talking
Yeah,
before
and
the
Amy.
eval.
And me on the phone.
Okay.
Yeah,
And
Amy on the phone.
Okay, so it's 237 calories. He gets this 4 times a day, as the paper says. That would only be 948 calories. And the paperwork states he's supposed to get 1,000 to 1,200 calories. Even if he eats one meal a day, that's what, an extra 50 to 100 calories. It's still short his intake, what he's supposed to be having.
Yeah.
So that was a concern.
So who
Do what?
ordered this and what who was the feeding?
Yeah, especially if we don't want him to gain weight and excel.
To the ER one time
Okay.
at APH. They admitted him and put him on peptide. And we had been talking in the back end about getting him back on regular Pediasure. He hasn't gotten back on regular Pediasure yet.
Well, I haven't gotten a prescription for it to be covered on the WIC, so that's what I'm waiting.
Well, that, and we can't do anything without it being on paper because we're in a DCF case and being
Yeah.
watched all the time.
Correct. We can't
do
just
anything
switch
without
his
it being on
formula
paper.
without it being on paper, considering the DCF case.
I didn't
Because
realize you didn't get it. Sorry.
But,
It's okay.
So APH changed it when? Because I lost you guys there.
Yeah,
It
like we're.
was beginning of the summer, I want to
Okay.
say. They
July.
changed it, maybe
Okay.
Beginning of
May,
June or July.
April-ish.
Why was he admitted there?
he was admitted because he went into a respite foster care and had severe trauma. He has social anxiety.
Okay.
He supposedly was not eating his.
It was
He
49.
had his blood
Blood
sugar was
sugars were low.
49.
Yeah.
So he had hypoglycemia. That's what he was released with, and
And that's
so
when
they
changed it
didn't
to
have
peptide.
him. They didn't have supposedly the Nutramigen, so they just put him on the peptide.
Okay, so
Yeah.
he was on Nutramigen and they changed him to
He
peptide.
never
Okay,
had a
makes
problem with Nutramigen in our care.
sense.
Never.
Yeah.
And
But
then
he's older now. Nutramigen is
Yeah.
more of a baby formula.
correct.
And then, so Arnold Palmer needed him to be on 5 peptides or
4.
Like, what's his nutritional goal, Amy?
I mean, 4 is more like 1,000 calories a day
Okay.
for his full nutrition. I forget even. Let me look at the last time we had
I know
spoken.
he gets 4
Yeah,
with
we
you
were
guys.
trying to get to 3 to 4 per day, depending on how he ate the last time I had checked in with
Okay,
anybody.
yeah. Check his weight today because he looks good on the curve. Amy.
so big.
What does he eat when he eats, Mom?
He'll eat like these puffs, these peanut puffs things, or these baby things we get for our daughter. He'll eat some chips like every now and then.
Rice and beans.
Rice and beans. Oh, he loves rice and beans. He was eating it last night. He'll eat like I'll make like a chicken soup. Obviously, it's not chicken, but he'll love it. It's the flavor.
Yeah.
And he'll eat baby cereal with prunes. that I make for my daughter, and he'll eat some of it while she eats.
Really
Is it all
melons.
puree?
And melons, yeah, he likes melons.
And melon
Is it all
juice.
pureed, or why do you say obviously not chicken? Does he not?
We
eat
don't
chicken?
eat, well,
Oh,
we're
okay.
Hebrew,
Oh,
so
Okay,
we
got
eat
it.
kosher. We don't eat
Yeah,
pork
yeah,
or
that's
chicken.
fine. Okay, not because he's allergic.
No,
I'm not
mm-mm,
sure.
No,
Okay, yeah. Okay, that's fine then.
Does he eat any table food puree any longer? I know he used to eat.
That's the baby cereal. It's
My main concern is what would do this to him, though.
So hang on one second, Dad.
Yeah.
So the baby
Okay.
cereal is puree, but like before he was eating like pureed table foods, like pureed pasta, pureed soup.
we try more of like actual food.
Okay.
And we'll puree like what we give our daughter, and
Mhm.
we'll try to give it to him, and he won't open his mouth for it.
Okay.
He won't open his mouth, period, really,
Tell
for
her when
certain
we first
things.
got there, he was scared of a spoon.
When he first got back in our care, he
Mhm.
wouldn't he was terrified of the spoon. He would cry,
He'll
shake,
smack
get
us in our
red,
face and tell us no and stop it, too.
and he would start shaking. He'd say, "Stop it."
Turn red, sweat, almost
Yeah.
throw up.
Mhm.
The first week was a lot to deal with.
Mhm. And my concern is what caused this.
In the state of seeing it, too.
I mean, I have no questions I want to ask, but I really wanted to do the feeding eval first. I mean,
Uh-huh.
which is I know you have to get what he needs to eat, so you can do the eval, which is
Mhm.
fine.
No, that's fine. No, I just so now he's eating like little pieces of table foods.
Yeah.
Okay.
What about drinks? Liquids has always been his issue. Is he drinking
What-
anything? But
he
not that he
drinks-
doesn't drink
Oh, he
Pediasure,
drinks
so-
fine.
He drinks fine. He won't drink Pediasure, but he drinks more than enough water.
Okay.
Does he drink anything besides water?
We have
Um,
oat milk here, too, he sips.
do what?
The
Oat milk. Yeah, we have oat milk and like
oat milk?
he'll sip that and he'll drink that. He likes it. We've given him like we had melon juice, like fresh out of the melon. He drank it. Dad, we have a juicer at home, and I make fresh juices. He loves it and drinks it. It's mainly now it's the eating. I've noticed he drinks fine. It's the eating.
Well, tell her about the, when he goes to swallow sometimes he'll, like, immediately throw up.
Yeah, if he goes to swallow some of the foods we give him, or even liquids sometimes, he'll go and just throw it up
Yeah.
before he even gets to swallow. He'll have it in his mouth. He'll be chewing, having the time of his life, and then he just throws it up.
And when you evaluated him before, he wasn't doing that, right?
He wasn't eating solids
Okay.
because he was when we were doing therapy. I don't even think we had turned a year yet.
No.
Okay, he was much younger.
Yeah, he was much younger. So that's why when I hear this about the solids, I'm wondering
Does he?
is how he's chewing. Is he getting a chunk of a whole solid, which is what's triggering the vomit?
Eat a whole bean. You can get a whole bean in
Like a whole
rice.
bean. Just like a
Yeah,
bean.
so that could if he's not chewing it properly, he could be.
But when you
triggering the
see
vomit, the
him
gag.
throw it up, it's
No,
actually
it's
it's
not, I'm not
mush.
chewing properly.
It's he's eating, he's chewing
Okay.
it properly.
It's in the water.
Yeah,
so
it's
that
not
would
that.
get
It's sometimes
better.
touching the top of his mouth. Like if he touches
Because
the
the
roof of
thyroid
the mouth,
has to be
because it's
processed
chewed
through
and he's
the
not
too.
swallowing it the right way, that can trigger a gag and then throw up. And I
Yeah.
think that's what
Yeah.
Kim is trying to say. So he may be mushing it, but not using the tongue the right way.
Right, he may be mushing it with his tongue versus. Wait, let me put my little hat on.
That has nothing to do with water.
So if he's I gotta put my hands. So if he's using his tongue and he's
Right.
using his tongue to mush the food on the top of his mouth, sometimes you get pieces like it can go back a little further and he's mushing it. But it just kind of triggers that. Like we all kind of have that protection reaction to keep ourselves from swallowing or choking, and that could be.
But what
causing
about
him
with
to gag.
liquids?
If it's with liquids, if he's eating and drinking at the same time, he could have little chunks of food pocketed down in here. So as he's
That's
drinking, it's triggering a vomit. If he's not eating and drinking at the same time, I don't have an answer for that. I'll be 100% honest.
All right, I can respect that.
We don't have an answer neither.
Okay. I wish I did, but
It's strange to us that was coming more consistent with you. I remember, and we read all your notes, and he was almost hit 100% with everything, and now it's just like complete
Not doing
opposite.
fun.
yeah.
I don't know if it has to do with environmental, parental, or medicinal. I don't know. There's just like something missing there.
Okay.
What about pooping? Is he pooping?
Oh,
often?
yes. Well, at first, like I spoke with Dr. Palomo about it. He kind of just like pushed it off. To be honest, he was pooping. It's gray and it was foamy. I spoke with,
Stinks worse
and
than
the smell of it is very bad. When I brought him in here August 20th, I want to say is the time when he threw up and the tube came out. When he threw up, he didn't pull it out. He's never pulled it out. He threw it up and it came out. I told Dr. Palomo about the throwing up, and I told him about the poops, and he just like kind of.
As a kid for 2 months almost.
He just pushed it off. I'm just being honest how I received it. But besides that, he poops every day. It's just what I said about the grayness and the foaming and the smell.
How much is he supposed to poop?
How much? Yeah. Oh, that's to the
I'm gonna
GI.
defer the poop question too.
I'm trying to pull up his x-ray, that's
So while she's looking for his x-ray, kind of walk me through a typical day. Like what time we wake up, what's our schedule as far as eating, using
Okay.
the tube?
We'll wake up in the morning. He usually wakes up between 9 and 10. I'm usually at work, but he wakes up. Do what?
I can tell if you want.
Yeah, because if you're with him most of the time, I'm at work.
Okay, so what I've noticed is, we'll start off like this, alright. His thyroid meds, he's not supposed to eat.
Hang on one second. I'm moving you closer. Okay, I gotcha.
Gotcha. Alright, from what I noticed, there's a lot of symptoms with a lot of these medications, and a lot of these medications he's on aren't supposed to go with other medications and so on and so forth. So originally when he was first in our care, I was feeding him right after his meds roughly. No one told me he couldn't. So I cannot feed him with more than an hour and a half to 2 hours after he gets his med.
Okay, so what time do you give him? What time do you give him medicine, and what medicines do you give him?
I give him meds in the morning, the Cetrazine, and the heart meds, and then the thyroid meds.
They're not GI. No.
Right? And then I wait an hour and a half to 2 hours to feed him because actually the thyroid med says 4 hours before eating. So I can't wait 4 hours to feed my child. So then I proceed to feed him an hour and a half, and then basically every hour and a half to 2 hours I feed him. I give him a little break to try and exercise his stomach to let him eat, and then again around 4:35ish he gets his other 2 feedings again an hour and a half after that.
Okay, so I just want to make sure that I'm understanding.
Yes.
So he wakes up between 9 and 10, and he gets his heart medicine and his thyroid medicine, correct?
And a Cetrazine.
And his
The Zyrtec.
Zyrtec. Oh, okay.
Yeah.
Zyrtec. Okay. And then, so let's say that's at 9. So then about 10:30,
Yes.
does he sit in a high chair and you try breakfast?
Oh no, I just feed. He doesn't want to eat usually. I feed him his formula.
Tube feed.
Okay, so he gets his tube feed at 10:30.
Feeding, yeah.
Okay, so that's
Is
one
it a bolus syringe?
peptide. Do you run that over a certain amount of time? Do you put gravity feed that?
Put it at 250 mils.
Okay.
250 mLs over, what's the rate, do you know?
It's going to be less than half an hour. Yeah, because that's 240, so that was.
Okay, so 250 over 1 hour.
Yeah.
Okay. Okay, so that happens at 10:30. So then at what point do you sit him down and offer food to him?
Between his second feeding and his third feeding.
Okay, so what time is his second feeding?
1 and 4, roughly.
Okay.
So he gets a little break.
So at 1 o'clock, he
Because
gets
normally
another
it's-
tube feeding.
Yes.
Okay, and then at 4 o'clock, he gets another tube feeding, correct?
More 5-ish, but yeah.
Okay, 5-ish, okay. Now this helps me, I just need to kind of get an idea. And then when's his last tube feeding?
Usually before or after his meds, depending on how active and how sleepy he is, because he'll nap randomly.
Okay,
So that's between, we'll say 7. If he fell asleep at 7, then I'll wait till after around 9.
okay, so between 7 and 9, he gets his last tube feeding.
Yes.
Okay. And you offer him food between the 1 o'clock and the 5 o'clock?
Yes.
Okay.
Well, I mean, I offer him food all day. He comes and he'll want to eat, but then he doesn't eat. He'll come around me and harass me and my wife and so on and so forth for food.
Oh, so he kind of grazes all day. You don't actually have like a schedule where like, okay, at 9 a.m. we sit down, we eat.
I couldn't do that without talking to you guys first. We're so watched. We've had DCF call on us twice. Once before he was in our care again, and then once after in our care. So they're really on us. I have to have everything in paperwork. I cannot try anything. So it's up to you guys to help me out and fill out the paperwork correctly. I cannot do anything on my own without paperwork.
Just being honest.
Yeah. Okay. No. Sorry. I have a very shocked look on my face because that surprises me.
Yeah.
Okay. So he kind of grazes in between, but no like actual like sit down meal schedule.
Eating solids?
No, really not.
Okay.
Because I didn't know what to do, like, to how far to push him
Yeah.
onto eat.
Yeah.
Because he was literally petrified of a spoon.
Okay.
So I'm not going to shove and try to, nudge and force him when I don't know. I'm not the expert. You're the expert. So we wanted to see what everything. I'll just let him graze, do what he does.
Okay.
And when you come in and tell me what to do, what we need to do here, and what you need to do over there, then we come on one accord and we execute it, hopefully.
Okay. And then
When does he throw up? Like the second and the third?
yeah.
What
So
time-
you were
what
saying
time
it's
would he-
between the 1 o'clock and the 5 o'clock that he tends to throw up.
No. His first feeding and his third feeding. So it'd be
Oh, the 10:30 and the 5 o'clock.
It'd be the 9 o'clock. It's almost every the first feeding.
So it's always the first feeding around 10:30.
Yeah, it's not 9, 10, 30, 9, 10.
Okay.
What does he throw up?
And then when does he throw up again?
I threw up yesterday on his third feeding, if I'm not mistaken.
Okay. So it's usually the first and the third, like the 5 o'clock
First or the
feeding.
third, yeah.
Okay.
It's more the first than the third, but yeah.
Okay. And does he throw up before the feeding, while the feeding's running,
While the feeding,
while it's running?
And,
while it's running, yeah.
and he throws up milk, or was it
The peptide.
the milk?
Yeah.
Comes out?
He also started taping his tube, the tape closer to his nose.
Mm-hmm.
Go I have for the reasons it doesn't come out no more because it was really far away from his nose.
Uh-huh.
So that helps out a lot.
Okay. And so when he's grazing all day, he's also drinking just like water and juices and things like that throughout the day.
He doesn't drink juice. We try to get him to drink juice. I even added a sip of Pedialyte in his juice one time because he was throwing up and I didn't want to.
It's not an everyday
But I
juice
had to
thing.
do it like that.
Okay.
But if we make
He
the
doesn't drink juice. He'll drink one type of oat milk, and that's Khalifa oat milk, which is pretty high in calories.
Hi. You're waiting for
But
me?
he just eats strictly water.
Okay. So Mom was saying sometimes when you use the juicer and make juices, he'll drink that.
Yeah, he'll drink that, but we don't drink that on a daily basis.
Okay.
So
Gotcha.
that's kind of costly.
Okay. So you do the oat milk daily and water, pretty much, mainly just water.
Yeah, exactly. Yeah.
Gotcha. Okay.
Is he still on the lactulose, which is the constipation
Yeah, the
medicine?
fresh juice.
Yeah.
That's about
he probably just
3
forgot
times
it.
a week.
He
Maybe.
just woke up.
When does he get the lactulose, the constipation medication?
We haven't been using that really because he's been pooping normal. That's as I needed from what we were told.
But he's still on it, but
Stopped. Oops. We don't have a problem with that.
Okay. And then when you said he gets his medication again before the last feeding, is that the heart, the thyroid, and the Zyrtec again, or just the heart and the thyroid?
No, he only gets thyroid medication once a day. That's a half a pill.
Okay.
He gets heart meds later. He's on 4 medications.
What does he get later?
His heart meds. That's it.
Okay.
So he gets his 3 in the morning, which is the heart, the thyroid, and the Zyrtec, the allergy meds, which he doesn't even have allergies from what we know of. And then the last one is the heart meds.
Okay.
And, Amy, do you notice the thyroid are
Which
not
they
eating
all,
for how many hours?
two of them
I
are
haven't
the
heard of that before.
I have heard
2 of the heart meds, the symptoms are throwing up?
Yeah, the thyroid and the heart meds are symptoms of throwing up, mood swings, behavior problems, and so on and so forth.
Okay.
Yeah.
So that might need to be run by the cardiologist or the person who prescribes the heart and the thyroid meds. That's some of the side effects of the heart meds are vomiting.
Right, yeah, those are making to like, okay, well, he's on all these meds, all these symptoms. He has some of these symptoms, whether it's from the meds or is it from him?
Right.
Yeah, but that's why we're going somewhere else next, which my wife will tell you later.
Okay.
But we're gonna keep you though. This
Okay.
is Kim, right?
Yeah, this is Kim.
Yeah, we're keeping you.
Oh.
But like, he never threw up with the Nutramigen the way he's throwing up with the
Correct.
peptide?
So Dr. Haddad is asking, he never threw up with the Nutramigen the way he's throwing up with the peptide. Is that correct?
Yes, never, not that we've ever seen, period. He's never thrown up besides when he was first introduced with it, and that was once or twice. After that, it was smooth sailing.
And it may be because the Pediasure is much more concentrated. Let's say toddler formula. It's a toddler formula. We
Okay.
have to go that route. But the question,
He did drink the organic Pediasures, right? Or he liked those, and that's kind of why we were wanting
Hang
to
on
go
1
back to the
second
regular
there.
Pediasure, right?
I couldn't answer that because he's never drank it in our
you guys,
But the thing is, he's also with when we first came to see Kim, he's been on this before. He's been on all the Peters. He's tried every formula possible.
When I saw him way back before he was 1, we attempted everything and he hated them all. The only thing that
It was
he
Boost Breeze or something.
exactly Goose Breeze was the only thing that he fairly tolerated. It was still not enjoyable for him. Like, he didn't love Goose Breeze, but he drank it better than he did the Pediasure or anything else. Bless you.
Thank you.
Yeah, our visits, he would kill like a half to a whole bottle within 4 hours.
Yeah.
On it with breathing.
Yeah, it would take him. I mean, he could maybe get through 1 in a day.
He didn't like it, but you do it a little bit. Now you know what's wrong.
So why do you think, Amy, you know him kind of more than all of us in terms of the formulas?
But it may be, if it's the first one during the day, it may be related to the medications, or maybe related to like a degree of delayed stomach emptying, and in the morning he's like, that's why the first feed is just too much for him, right? I don't know. How long have you had him back for?
Since the 8th, since his birthday.
The 8th of September.
Oh, so it's still a little bit.
It's still early.
It's
Yeah.
not.
Yeah.
But you've been consistently seen throwing up with him.
20 days.
Yeah. Since before he actually got home. When we were doing the visits, like, we would do overnight visits, and we were doing, like, just, like, 4-hour day visits, and he would still throw up.
That's when he was at Arnold Palmer?
No.
Okay.
No,
When he was-
that was earlier in the summer that he was admitted.
Okay. Yeah.
I mean, I think if we could find something that he would drink, which I know has always been our struggle, but he sounds like he's drinking better now. I like we said on Minor Wars, I'm happy to try the regular Pediasure and see if that helps. In theory, you would think the peptide would be tolerated better, but it might taste better and he'll drink it, and then we don't have to have that tube anyways. I'm kind of toying with the idea of Cape Farms in my head.
Yeah.
It's dairy free. They have a peptide if we needed it.
Is it
I don't
kosher?
know.
Is it kosher? Do you know, like you guys follow kosher?
Yeah.
I would have to double check it, but it's pea protein, so it's
Yeah.
kind of more along the lines of the oat milk that they drink at home.
Okay. Yeah.
But it just has to be kosher. Is the only
I
strict
think
thing.
it is. I'll have to double check it, but I'm pretty
What's she
sure
talking about?
Kate Farms. It's a
Like a
Nutritional
vegan
supplement?
based formula. It's a
Yeah,
vegan.
and it's got
Yeah.
some vegetable and fruit aspects to it, but yeah, it's a plant-based formula.
I've had kids that don't like Pediasure or anything, and they drink Kate Farms well. They like it tends to. There's something about the taste of it they seem to like a little bit better.
It's not as strong. It's not as sugary, and the flavor is a lot more mild. My kids drink it a lot. They like the pediatric one, and I can tell you it's just pretty mild. It's not like Pediasure that's so overwhelming.
Even for the NG, I feel like it makes them throw up less, right? If we're worried about the throwing up from the peptide because it's too concentrated, the K-Farm may be the way to go. And his stools may become a little bit less foamy because we're giving him less concentrated, right?
Yeah.
Technically, like carbs content between the K-Farms and...
Let me look.
So, I do want to say, when we do the actual, like, the feeding part of this, can it just be Oba, you, and me? Because he does have very, social anxiety, and the observing
the
him.
window.
Because he could throw up,
No, we don't stay in.
Yeah, okay.
And actually, in the beginning, I'm going to go out too because I want to see how it does. How
Okay.
it does with the two of you.
Okay, that's
Kind of
fine.
observe what's happening at
No,
home.
that mirror is a window.
Yeah.
So we can
Yeah.
see it and hear. Yeah, I think that's from a GI nutrition. Amy, what's his goal? Because he's not eating much, and it sounds like he's not eating much.
Yeah, 4 a day is more of a 4 to 5 is like regular calories to catch up calories, basically.
Okay.
And I kind of think I can send you a sample of the Cape Farms to try with him, but I think getting a regular Pediasure from WIC for now, just to try as well and see if it helps anything. WIC won't give us the Cape Farms if we like it, so we'll have to position it.
Can I add a third one on there?
Healthcare company, which is fine. It's just not something that our
Right.
friends provide us, so we know that. So kind of as a, in the meantime, as we get things figured out, take regular Pediasure from them and see how that goes.
And Amy, since you were involved for like with parents worried about feeding him an NG feeds and the DCF, what do? Do we just write a note saying feed first before you give an NG, or what would be the fix for that?
Yeah, because I would like to get him back on a regular feeding routine where we're off, even if we're just offering to kind of start to work through this aversion that he has and get him back on track of actually sitting and eating
Right.
and
Before
trying
the
to
pediatrician.
drink before we get to the tube feeding if possible.
Hallelujah.
Yeah.
So yeah, I've never run into that before. Do we have to write something for WIC?
We
Like
would
how?
just write,
Not WIC,
not for
sorry.
WIC, no,
Okay.
it's like
Yeah.
a medical order basically that we want
Maybe
them to
under the
feed
ABS.
first and then wait so long and then do the feeding.
Okay.
Or we want to get into the breakdown of it, we just have to write it down.
Okay.
Like a medical
Okay.
order.
So we'll write it out on the
Not
ABS.
WIC.
Yeah, and can you specify on your ABS too, Amy, so it's in all,
Yeah.
and the WIC form you said for Pediasure is there for you, right? But we can,
Yeah, we'll make sure, stop down on the second floor so we can get a copy of it to you guys
Okay.
for the meantime.
yeah, so in the ABS, can we, because obviously we don't wanna run into problems, right? Kate Farms, Pediasure, Petside, and Pediasure, so as long as they're staying with 4 cans, we don't care what formula they use?
Yeah.
Okay.
Absolutely.
Okay, and then can we have them, like, we'll, and I'll write it in mine, I don't know if it needs to be in yours too, that, so if we're doing the 4 bolus feeds a day, so if we sit down and do like a breakfast, lunch, and dinner, and then the last one would be like a before bedtime snack or whatever he drinks can be deducted from the bolus, so that way he's getting, or do you want it to be above and beyond? I don't want to cause him to vomit anymore. Okay, perfect.
And then, as a backup plan, if he continues to throw up with the first feed, maybe parents can run it over an hour and a half, so slow the rate?
Yeah. Yeah. I think that's good.
Yeah, I
And
think so.
Kate Farms is kosher, yeah.
Okay, perfect.
Oh, okay, that's good.
Thank you.
Thank you.
Perfect. All right, so we have a plan. I think we're good, like, do you guys need Amy? Do you have any questions for me? Okay. I don't have any questions for you either. I'm gonna send you with me to the next room anyways, so can see.
Okay, yep, we'll do our feeding stuff. All right, little man, you ready to eat? You ready to eat? Come see me. Come here. You can bring this back. Yeah, you can bring it. Come here. Come see me. Are you gonna make me come get you? Are we gonna stay here? Me and Mama are gonna have a snack. Yeah. You and Mama are gonna have a snack. How's he doing, Mom, with like brushing his teeth?
Oh, okay, yes. At first, when he would brush his teeth,
Uh-huh.
Daddy usually does that because he's such a daddy's boy.
Yeah, boy. Yeah.
At first, he was like not opening his mouth at all for it.
Uh-huh.
He wouldn't open his mouth really for anything, to be honest. So, Daddy just usually like started kind of. I couldn't really tell you, but I'm just gonna get it. Yeah, because you're the one that usually brushes his teeth.
So, yeah, I was brushing my teeth. I was dragging him in the bathroom. He doesn't want to not be around me, so.
Mm-hmm.
And then he's like, teeth, please. I'm like, okay. And I already had a toothbrush a long time ago because I was trying to introduce it before they stopped this from seeing him.
Uh-huh.
And so he grabbed it. I put the stuff on. He was like brushing his lips a little bit. And I was like, whatever. And I let that be. And then the next time he came here, he was getting closer in his mouth. I
Can
let
you take
that.
his shirt off real quick?
And then he started opening his mouth and, halfway brushing his teeth. And then lets me go in and actually brush his teeth now.
Okay, good.
Ready to brush his teeth. Another thing I noticed though is his breath really smells.
Mm-hmm.
I don't know what that is even after he brushes his teeth, so I don't know if it's from his gut flora emanating out of his esophagus. I have no idea, or if he has like a cavity, because he's never seen a dentist.
Yeah, he's a little, usually kids start at the dentist around, I think they recommend like 3 or 4.
I know Kant said it. Karch said it one time, but I don't know. It's no big deal. I doubt he has a thing.
Yeah, the only other thing is,
It's probably like food, he needs to be flossed or something, and that ain't going down.
does his breath smell acidic, or,
Yeah,
yeah?
yeah. Putrid acidic type.
I'm gonna run that by Dr. Haddad. She walked over to the other room, but I will let her know that.
Thank you. Yeah, now I'm trying to potty train him.
Trying.
That's not working out like the teeth.
Yeah, that's always a fun one. I'd love to say I have advice, but if it weren't for my son's daycare, I'm pretty sure he'd still be in diapers.
All right.
Hi. Hi, handsome. I want to see your teeth. You show me your teeth? And then we'll let you and Mama eat. You remember this? Ready? Say, oh, we're going to get it. We're going to say, blub, 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 blub. Where's those teeth? You got teeth in there. Oh, there they are. Tickle, tickle, tickle. Tickle, tickle, tickle. Oh, my goodness. Good job. Good job. Did you let me tickle your teeth? Then say, ah. Oh, good job. Tickle, 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 tickle. Tickle, tickle. Tickle, 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 tickle. Oh, so big. You're so big, Oma. Good job.
I think Amuna wants to see Cam.
Mm-hmm.
All right, you ready? We're going to chew. You got big. You go. Ready? Say, like it. Oh, good job. Yes, say, chew, chew, chew. Oh, good job. Oh, those are some strong teeth. Good job. Did you decide? Say, ah. Get it. Arr, arr, arr. Get it. Say, chew, chew, chew. Good chewing. Yeah, good chewing. Good job, buddy. There's that smile. There's that smile. Oh, good job. You got strong teeth. Good chewing. Good job. Okay. Are you going to eat with Mama? Yeah? Let me see.
Okay.
Before I
Things that he
leave,
likes.
show me what he likes because I
He
want to
really
see him chew.
loves these.
Oh, okay.
And these.
Okay, so either one of those.
Either one of these he'll really love. I'll give you like one or two.
Yeah, that'll be good because then I can see him chew.
And then he really likes these like wow. I don't know why, but whatever.
Are you going to do it? No, I have
The
to do it.
peas, yeah.
Okay, ready, say, ah. Okay, let's break it. Oh, it's peanut butter. Let's get it.
I bet you were so happy to see her.
Alright, he ran right up to her.
I know.
You missed me, huh? You were my buddy. And you're not going to chew it? He's going to give it a kiss. Ready, say,
Maybe one of these might be more successful.
Oh, would you rather have that?
Yeah.
Which one? Oh, but choose.
She's an expert on that. I'm just a man.
This one? Oh, give it a kiss. Say, mwah. Oh, good job. Did you give it a kiss? Did you give it a kiss? Say, mwah. Those eyelashes, buddy. Oh my goodness. Let's feel your heart. Mwah. Get it? Say. Let me see. Touch those teeth. Oh my goodness, I touched those teeth. Did I do it? Did I touch those teeth? Oh, good job. Get it. Say. Boop. Yeah. You want to do it? No, not feeling it this morning. No. Oh. Right there. Let's touch our teeth again. Say, let's touch them. Touch. Oh, we got him. We got him. We got him. You do the truck. Touch it. Let's touch it. Good job. Get him. You're not feeling the chewing today, huh? Boop. Where's the teeth? No. Let's touch one more time. Oh, yay! Oh, what? Yay! Bloop, bloop, bloop. That one good. What's she gonna do? Ready? Let's touch again. We're gonna touch. Boop. Good job. Yeah, good job. You just don't feel like eating, huh? No? You do a couple more? Oh, good job. Ready? We're gonna count to 3. 1, 2, 3. Good job. Did you get it with your tongue? Good job. Yeah. Let's count again. 1. Oh, we gotta count to 3. 1. 1. 2, and oh, 1 done. 1, 2, 3. Good job. Good job. Yeah. That's so happy. One more time, and then we'll be all done. Last time. Ready? We're going to count to 3. We'll do our quiet hands. Let's do 1, 2, 3. Good job. Good job. Okay, I'm going to put these right here. I'm going to let you eat with Mom. I'll be back, okay? Do you need anything?
No.
You good? Okay.
Yeah.
If you do need anything, I can hear. I just kind of want to see how he does, like how things are going.
Mm-hmm.
And then I'll be back.
He wouldn't open his mouth.
Really?
Yeah.
Oh god.
Which one do you want?
Was he mad and refusing, or just like, nah, I'm not opening it?
Just not opening it. You want some beef?
Okay.
Yummy. I can't open it. There we go.
Well, it's way too early for him anyways, though.
Let's try some cereal first. Some tunes. Oh, come on. Just do it for Mommy. One time. One time for Mommy. And Daddy.
Overbite?
Open bite.
Overbite?
Let's take this off because you probably don't like it. Ah. Open. Ah. Come on. Just try it. Want to put it on your lips? Mmm. Mmm.
By the way, do it, come on.
It's okay. Calm down. Open bite. Just put it on your. Just put it on your lip. Mmm.
Do the chomping motion. No.
Oh, I got all over his face. Open up. Open. Say ah. Say ah. Oh, but come on. Let's try. So wet. Hey. Put it down. Just, put it in your mouth. Just chomp, 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 chomp. Chomp, 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 chomp. Here. You want Mommy to do it? Yummy, Oba. It's so yummy. Come on. Oh, it's okay.
So Cece had no idea why he was doing this?
No. Come on, just one more time. One more time.
I bet you they quit feeding him and starved him.
Alright, let's try this. You looking at yourself? I'm watching you. I'm watching you. Can you try some beef? Some beef. Some
He
beef.
was chewing that thing the other day.
Oh, I believe you. For you.
Oh.
It's okay. You don't no crying. It's okay. Daddy? He's right there.
Ovadia. Ovadia, bite.
You're gonna beat.
Eat. Chew. Swallow.
Come on, Ova, please. Take one bite for Mommy. One bite. Yummy. I see you. Yay. Baby? Baby's not here. Yay. Huh?
You probably heard her in the background.
Daddy? You wanna take a bite for Daddy? He's your big man. Come on.
Take a bite, we go for a ride.
Take a bite?
Bite, we go for a ride.
Take a bite?
Over bite.
Oba, bite. Yeah, Daddy. Yeah, take a bite, Oba. Bite. Take a bite. You can't eat with your finger in your mouth. Yummy.
That's the crazy thing. He actually can't eat with his fingers in the mouth.
What?
He wants Daddy to sit, I think he said.
Oh, you want Daddy to sit? He's sitting. He's sitting over there. You can't see him. Yummy.
Is he eating?
Not really, but I'm putting it on his mouth, trying to encourage him.
Gotcha.
You want a peanut puff? No? You don't want that? Do you want this? Oh, yes you do.
Or you think you can build it up, you can.
I will.
Instead of us trying to get it later and take forever.
Oh, no. Bite. Huh?
Is that the toy making a noise?
Yeah, it's a fire truck.
Oh.
Yay, Oba.
I was like, they're busy today over there. Oba, bite.
Yeah?
Oba, bite. Yeah.
Oba, take a bite. Yummy. Want to take another bite?
Oba, take a big bite. Be a big boy.
You gonna throw that at me? Yeah. You just look so mean. Take a bite. Come on. Yummy. Oh, let's not put it in the bowl. Let's put that down. It's on your fingers. Wipe it off. You want to drink it out of this? You want to try it out of this?
He ain't eating the peas? He ain't nothing?
Nothing. No? You don't want to try it with Mommy for Mommy? No? You're not having it? She's going to come get you.
So is this pretty much how it
You
goes at
guys.
home?
Exactly how it goes at home.
Lots of bargaining.
I mean, he'll do a little bit more, but
Uh-huh.
it is pretty early too, though. But he'll do it a little bit better. But like, this is just basically how it goes.
Yeah. When you said, I mean, it sounds like if he's vomiting in the morning is probably by far his worst meal of the day. That would be my guess.
He like usually seems, if my daughter, so our daughter eats,
Uh-huh.
because she's 9 months old now.
Okay.
So she eats
Oh my
baby
gosh,
food.
already?
I know,
I'm
right?
gonna need to see a photo.
I'll show you a photo before it's over. So she eats baby food like 3 times a day.
Okay.
Slowly integrating, table foods because she has 6 teeth, so she can eat baby food. So like I've noticed that when she's eating or when we're eating, he seems a little bit more like
Whoop.
comfortable
Be
with
careful.
it.
Just gonna squeeze that
I guess
away.
you could say. Oh,
Uh-huh.
let's put the lid on and then you can play with it. So like whenever she's eating, he's like right there, like sitting, like staring at her, like so excited, and he'll say, "Bite, Oba, bite," and then when you go to give him a bite, he'll run away from it.
Okay.
But sometimes he will actually take it. Like when we were doing the visits, he was killing the baby food with the prunes.
Okay.
He was like just constantly come back for more and more, and he was actually swallowing it.
Uh-huh.
But that's when she was like wasn't eating table foods as much anymore. But she really doesn't get that much. But that's just kind of how it goes at home. I don't really know. I mean, he might be able to.
Has he had his first tube feeding yet today?
No, I did not want to make him full.
Okay. So that was my question because I was
Yes.
wondering.
I did
Okay,
not
so
want him to be full.
He didn't have his tube feeding today.
Still up in the car?
Yeah, I'll put it up in the car.
Exactly.
Yeah. He'll get it when as soon as we get home, though.
Okay.
Kind of will probably be around the time he usually gets it, anyways.
Okay, so this will actually help me with kind of what we want to do. What is sister's schedule as far as the 3 meals a day?
So she is still breastfed. She still gets breast milk, but usually like kind of half and half. I pump and I breastfeed her.
Okay.
She's a biter. So she gets 5 feeds of milk a day. So regardless if that's on the breast or bottle, it's still milk. She gets no formula. because she's allergic to milk. She can't have any milk protein
Okay.
at all.
Okay.
So she gets, so say around, I go to work at usually at either 4 in the morning or 8 in the morning. So before I go to work, I feed her, and then, unless it's like 4 in the morning, I won't feed her because I'm only at work for like 4 or 5 hours, so she starts still sleeping through the night.
Okay.
And I'll have a bottle prepared for when she does wake up around like 9 to feed her a bottle.
Okay.
So she gets a feeding at 9, she gets a feeding at like 11, and then around 12 is when she gets her breakfast, which is a bowl of baby food. Bless you. And then at 11, and then around like 2 or 3, she gets her next milk feeding, and then around 5, she gets her lunch, and then 6, she gets another milk feeding. I think that's like, what, 4 feedings of milk so far? Or 3?
Something like that. I didn't write down the first
That's fine.
one,
That-
so yeah.
yeah.
I'm just more concerned with the solids.
Yeah, that's
what I'm trying
fine.
to
And
figure out.
then around 8 is when she gets dinner.
Okay.
And between lunch and breakfast is just typically baby food for your age. And then for lunch and dinner, she gets her baby food, but she also, I try to give her like what we're eating. It's like little pieces of it, like and then some puffs or something that she can chew and use her fingers to pick up, which would be these.
Yeah.
These
those
little, little baby stuff that babies can eat at that
Okay.
age. So she, that's her schedule.
Okay. Well, that helps me because I think that if she's interested in when she's eating, getting the two of them potentially on a very similar schedule will
Right.
help.
Right.
We might even have to add another extra meal for him.
Right, yeah.
In the
Because
morning,
she's
but
still
that's okay.
little, so.
Just when she's getting more of her milk, maybe we'll add another little.
Snack or
Yeah.
breakfast or something.
All right, mister.
Oh,
We're
it's
going to do
Tim's
something
turn.
together.
Oh, you need your chair.
Yes, we are. Oh, you're fine.
Ooh,
Whoa.
yeah? You gonna eat for her?
Oh, you want bubbles?
Mm.
Bubbles.
Everybody loves bubbles.
She's gonna get you like she used to.
I know, we all have bubbles. Let me see if my whale's full of bubbles. But now I can't blow bubbles because I gotta wear all this contraption. Oh yeah, there we go. Where's your spoon, mister? I'll use
I
this.
have, yeah, you can use it.
Let's see.
Let's grab this real quick. You can use it for whatever the baby food or the beet. I don't really care.
Actually, I'm gonna use it with absolutely nothing on it at first.
Okay.
Oh, you want me to take that? Okay, we're gonna play bubbles. We'll put that over here. We're gonna play bubbles with the whale. Yeah.
Did you bring the silicone spoon?
Yeah,
Okay.
not hers. Sorry.
Yeah.
Well, that's hers too, but.
Yeah, I know what you mean.
Bubbles. Oh, you want to see the bubbles? Okay. See my spoon? We got it open. Say ah. Then we play bubbles. Ah. Oh, good job. Yay. Ready? Here they come. Here they come. Ready? Woo.
Bubbles.
You get them. Get them. Pop, pop, pop.
Spell out for bubbles.
Pop, pop, pop. Boom. Boop. Oh, we all love bubbles. Boop. Pop. Can you get it? It's coming. It's coming. Oh,
pops.
you lost it. Oh, you lost it. Say, ah. Oh, that's such a big open. Good job. High five. I know bubbles. Okay, ready? Here they go. Watch them. Say, whoa.
Bubbles.
Bubbles, get them. Pop. Pop. Bye-bye. Bye-bye, Bubbles. Bye-bye, Bubbles. Okay. Bubble, more bubbles. Let's have bites. This one's got cereal. You know what? I'm gonna do the flatter spoon.
That's
Because
fine.
he's trying to bite it. Are you biting my spoon? Okay. Okay. Are you ready for bubbles? Here they come. You took your bite. I didn't give you the bubbles. Here they go. Whoa! Whoa! Get him!
Look at the bubbles, Opa.
Oh, pop. You gonna get it? Oh, get that one. Oh, good job. You got do more bubbles. Yep. Open for bubbles. Oh, good job! Yay! Here they come. Woo! Boom! Get him! Up! 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 Oh. Get it, Elmer, get it! You got it! You got it! High five! Yay! Good job. Let's have this one. Let's have this one. You're making a face with that one. And you look like you like this one better when Mom gave it on your lips. Good job,
yummy.
buddy. Good job. Here they come. Woo! Oh, get him. Get him. Oh. Where'd they all go? Oh my goodness, where'd they go? Where'd they go? Ready? Let's do bite for bubbles. Oh, look at you. Oh, try again. We missed it.
Yay, Oba.
Yay, big. Good job. Get him. Get him. Whoa. You gonna pop him? There. Pop. Pop. Oh, here they come. Oh, you got it open. Oh, big open. Big open. Yum, yum, yum. Let me see, are they all gone? You gotta swallow. Yeah, you wanna hold it now. That's gonna be a whole nother issue. Whoa! Get him! Can you get him? Here they come. Oh, pop! Pop! Which one you want? You want the spoon or you want the puff? You want the puff? Okay. Thank you. Ready? Let's open. Say, and then we'll do bubbles. Open and then bubbles. You can do it. Oh, good job. Choo, choo, choo. Yay. Choo, choo, choo. Say. Show me how you chew. Yeah, show me how you chew. Here it comes. Woo. Oh, boom. Get him. Oh, protect him. Pop, pop, pop. Don't let it get him. Yay. Have drink. Oh, good job. Would not swallow a lot. Swallow.
Do what?
Oh, good
Does
job.
he not swallow a lot?
Oh.
This is a new habit for you, huh? I see why we vomit. Because you like to hold it all in there, and then you can't swallow. It's too much. Yeah. Good thing I have the shield, because sometimes it flies out.
More.
Does he drink water in front of her?
That's what he's doing right
Yeah,
now.
he's drinking
Okay.
right now. Swallow. Yeah. Good job, Oba. Are you ready for more bubbles? Yeah, make your mouth all empty. Say, Is it all empty? It's got all go to your tummy, and then we'll have more bubbles.
He's trying to check her.
Swallow. Swallow. Make it all go to your tummy for bubbles. Let me see. Say, Let me see. Oh, it's starting to, you got a little bit in there. Yep. Swallow. Swallow. I don't think the water is going to help, my friend. Go ahead, give it a try. Okay, go ahead. No? Okay, swallow then. Swallow. Ah. You know it'll help you swallow. It's open for bubbles. Ah. Open for bubbles. Where's my quiet hands? Good job. Yep. Open. Open. Ah. You can do it. And then we'll play bubbles. Ah. Ah. Thank you. You guys swallow. Yeah. Good job. Good job. Here they come. Here they come. Oh, here they come. Woo. Uh-oh, where are they? Are we out of bubble juice? Nope, there they are. Pop. Pop, pop. Where'd they go? Alright, let's try again. Open. Yep. Open. Oh, good job. Say, Gotta swallow. Num, 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 num. Will he eventually swallow it? Or will he?
Usually, sometimes he will, but it's more on the.
Oh, I'm trying to blow it. Hold on, that's not.
Do what?
Mostly he will.
Mostly.
Sometimes he'll just keep that in there and put more and then drink that. It's weird.
But then sometimes
Yeah.
he'll just end up spitting it out.
Yeah.
More like throwing it because
Yeah.
his eyes will water and there'll be green stuff coming out of his mouth or brown stuff. Like last night, I don't think he spit up or threw up last night from the baby food or the table food. Sorry, I think he ate it all.
Yeah, he ate all the table food, but he threw up from the feeding after.
That's what I thought.
Yeah.
Yay! You can't cheer when you have a mouthful of food. You can't cheer when you have a mouthful, mister. Woo!
Maybe he's part chipmunk, and maybe no.
Are you part chipmunk? Chipmunk, chipmunk, chipmunk. Oh. Chipmunk, chipmunk, chipmunk.
Those are pretty big cheeks.
Yeah, you can't giggle when you have a mouthful of food. I know you want to. You swallow. You trying to knock my hat off? You would drink water. 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 No water? No thank you? You put it in there? No, sir. Thank you. I'll take it. Thank you very much. Thank you very much. Okay, let's do bubbles. Oh, almost. Good job. You've got almost most of it swallowed, but you just are like holding it in there. Maybe you don't like the way it tastes. I don't know if that's the case though. Ooh. Oop.
He ate like half of this yesterday.
Yesterday?
My dad, yeah.
Okay.
When I got home, it was like he was killing it yesterday.
So you're a hit or miss. All right, mister. Are you all done? No? You're all done? Okay. Swallow. Swallow it all to your tummy, and then we'll get out and be all done. Okay? Make it all go away. Okay. Make it all gone. Make it all gone.
For swallow.
What?
I want to see.
The sign language for swallow.
I don't know a sign language for swallow.
I don't know either. I
I
know
know sign language
Spanish.
for all gone.
I got Spanish for swallow. That's about all I got. Say, traga. He's like, huh? Yeah.
He
Oh. Swallow, make it all gone, and then we're all done. Yeah? You gotta empty your mouth. All right, mister. Let me go touch base. Oh, I gotta tell her about the bread before I forget.
Okay.
What questions do you have for me?
I mean, I kind of have a list of questions for the both of you.
Okay, so I will wait
Yeah.
on that.
Okay.
Definitely though, from a therapy standpoint, I think we need to come back and do the 2 times a week for 12 weeks to see if we can't get him on a better schedule. I'd like to get him to the point where we're offering. Honestly, I would, he's kind of at the place where if we're looking at it from purely so there's 2 different goals. Sorry, sometimes.
No, you're okay.
Put my thoughts together. So there's two different trains of thought and 2 different goals. One is get him eating and drinking enough calories so that we can get rid of the tube. The other is chewing and eating a regular toddler diet. Unfortunately, and this is kind of like before, those 2 goals don't always go together. You can eat more volume of puree than you can eat of table foods to meet your needs. So, which would mean if he's eating more like table food puree, like you're pureeing the foods that you're making, and we can calorie boost those foods and we can work on that. At the same time, while working on chewing and seeing how he's chewing and making sure that he's actually chewing the foods and eating and swallowing. So kind of where you are with your daughter right now, where she's getting that balance of she's getting puree, she's getting breast milk, but she's also getting little bits of table food, but she's not eating enough table food to sustain. That's kind of where we're going to be. So, because I would love to say we can just, you gotta swallow, mister. I'd love to say we could just make that jump and go straight table food, but I don't think that he's going to be able to eat enough table food initially to meet his needs, especially because drinking is what's really hard for him. And if we can get him, even if it's the Kate Farms or the Pediasure or whatever, get the vomiting under control and figure out, even if we're using the Pediasure and the Kate Farm to make some of the puree, that counts in the volume.
Okay.
So, if we can do that and we can get to the point where we can get rid of this NG, because he's had it for such a long period of time, we need to see if we can get him eating enough that we can, get rid of that. And especially since, normally hydration is the big thing. If he's drinking a lot of water, that's good from a hydration standpoint. He's older now, so he's not as reliant on drinking as he is on eating for hydration. So like when you're little, you get, when I was at the age I was seeing him before, most kids get 100% of their, like your daughter's age. She's getting 100% of her needs through breast milk. The eating is just supplemental. It's teaching her how to swallow puree, how to eat table foods, how to chew, how to do all of that. So it's teaching her all of those things. It's not necessarily for nutrition. So once you hit this age where Ova is, that's when you start eating foods for nutrition and drinking less. So you start seeing that volume of liquids kids are drinking go down and the amount of food go up. So now that we're at this age, we can kind of take advantage of the fact that we don't necessarily love to drink. We can drink water for our hydration. We can drink the Kate Farms or the Pediasure or whatever we end up going with, but we can also use it for making puree and making sure that we're getting that volume of food, and then play with that balance of acceptance of puree and table foods for learning to chew. Once we start meeting our needs at 100% and we're growing and we're gaining weight, then you can start making that transition from less puree to more table food. So as his skills get better, you'll see him eating more and chewing more, and we can start backing back on that puree. Does that make sense?
Yeah.
Okay. So that's kind of where I would like to focus. What do you think, mister? But we're definitely going to have to work through this holding. Because that's going to be, and that's a hard one to break, but
Mm-hmm.
we'll work on it. We'll work on it. We'll work on it. You just have to remember.
Is that something you could train a child to do, or they learn on their own? Hypothetically.
To swallow,
Or to hold, no, hold it.
holding.
I've never
So
seen that before.
kids a lot of times will hold for, you know, like for behavioral reasons. We don't necessarily know. It's a hard habit to break once they get in that habit. But it's just another way that kids learn. If I start holding my food, they can't keep shoveling food in. And it's another behavioral technique to kind of avoid eating.
Gotcha.
So it just kind of becomes a learned behavior.
Gotcha.
A lot of times typically kids will hold food more with solids than they will with puree, because with solids it's like with those little peanut butter puffs or the snap peas and things like that, they kind of dissolve in their mouth and they just eventually swallow them. But as kids are learning to chew, and we start giving them things that don't necessarily dissolve, if they don't chew it all the way, they start holding it. And that's where we start seeing that, the holding, but he's holding complete puree.
Yeah, in hot water sometimes. It's so weird. He's never done that before. That's why it's just so
Yeah. So,
weird. Yeah. Alright.
yeah, I've never seen him do the holding before either. Like when I saw him before, I never saw him hold food. This
Yeah,
is
he's literally never done that his whole life.
a new
Never.
behavior. Hi.
Yeah.
Yeah, I know. I see.
Yeah, that's where I have like questions for both of you whenever she comes back
Okay.
in. But I can,
Let me go grab her and see. But definitely one of the things that we'll give you guys today for sure is I want you to start, even if in the beginning it's just sitting him down when sister's eating. Do they both have a high chair? Yeah. So even sitting them side by side in high chairs, and in the beginning, just offering him bites when she's getting bites before, so that way we can arrange his tube feed so that he'll sit down beforehand, eat or offer food, and then get his tube feeding after, so we can get him back we're sitting down for 3 meals a day. And you know, even in the beginning, I would keep it happy and keep it pleasant, and you know, sister's eating, Oba's eating, yay, everybody's eating, even mom and dad maybe are eating, you know, just to kind of get him back in the routine of I sit and I eat versus everything goes through my tube.
right.
So, okay, let me go see where she is, and I'll be right back. I'll be back, Mama.
So Paloma's not there?
No,
The nutritionist?
no,
The surgeon?
no.
So only 2 people?
Yep.
Okay.
Yeah.
Makes 0 sense.
The nutritionist is on the phone. You want some water?
Okay. I got you.
No? You want water?
But Paloma's never called.
No.
Oh, the surgeon. Okay.
No.
Alright. Yeah, what about the blenderized tube feeding? If he doesn't eat it, can we put it in his tube, so on and so forth, to get his stomach used to digesting real food? You know what I'm saying?
Yeah, that's why I'm waiting on him to come in.
And his biotics in his stomach to, actually start working. And model eating is not his thing.
Yeah, I'll ask him to come back in.
Especially when the model eating he's using keeps throwing up a third of the time, or a fourth of the time.
Right. Mama's back.
She not seen that.
No.
She said she's never seen nothing like this, huh?
Yeah.
That's what Fox Mom does, bro.
I need a pen.
And she said it was a learned behavior.
Yeah,
Like she did it on his own, or he was taught it.
I would say yeah. Get my questions out.
So be respectful and
Okay.
search for him.
Yeah. You want to get down? Did you swallow? Yum, 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 yum. Open up. Show mommy.
Oh, but eat.
Did you swallow?
Oh, but drink.
He was opening up for that beef stuff
Right.
before she even got the spoon next to his mouth.
I literally feel like they stuck him in like a dark place and didn't feed him.
Probably.
Probably locked him in one of those rooms that heard about and locked him away.
Mhm.
I know a quick way to learn how not to eat.
What?
You don't feed no one or the person don't eat. Like when I was on that liquid fasting diet, when I had my lockjaw, I totally didn't want to eat it all, bro. Even after I could eat. I was like,
Let me
yeah,
see.
I don't
Show mommy. Nuh-uh.
I don't do it
Close.
all.
Close. Swallow. You have a little bit left.
Like when I had my tonsils cut out too, oh, I totally didn't want to eat. Call your eyes out, that's up. So like how you said, oh, we should probably talk to the doctors about this man. Having those symptoms. Like he has those symptoms, it's either him or it's a med. You know what I'm saying?
Mhm.
Ah, gotcha.
Right,
Okay.
Okay, we're down to all that short time, because mom had questions. Yeah, mom, do you have questions for us?
Yeah, one second. I'll try to put that back on there. Okay. Do you have a pen I can use?
Mom, do you mind putting the mask
Oh,
on?
yeah, I'm sorry. I was doing it.
Yeah.
Okay. It's kind of how it listed them, so.
Some of it
Beware.
I may not be
That's
able to
fine.
answer, but we'll see.
I don't expect you to be able to answer all
Yeah.
of them.
Let's see.
Let
Hey,
me see where to start.
Why is the dilemma there?
because he doesn't run the feeding clinic.
Gotcha.
Okay.
I run it, and usually I consult with him for the primary GI things, just because he knows you guys better.
Right. Okay. So I won't have like a statement. I just want to say so like I was talking to Kim about it. Do you think that more of he could have picked up this trait from like another child? Because I know like the foster home he is living in, the other child does have feeding problems. Because we came here to the feeding clinic with both of them. The other child would come in. Could he have possibly learned some of these traits from that child more so than on his own?
It's a very hard question to ask and to answer. Because feeding difficulty is very complex.
Right.
And it has different things to do with it. So I would say I don't think I'll have a clear answer for you.
Right. Okay.
But it's very complex. It's clearly developmental, clearly environmental, clearly food related, but it's hard to say which one swayed him more.
Okay.
And it's very hard to answer that. And I'm guessing
Yeah, I
Kim
mean,
would
we
have
have
the same
a
problem.
lot. I have a lot of kids that I see, and they have feeding issues, and they have siblings that
Have no
100%
feeding problem.
have no feeding issues.
Right.
Okay.
I mean, it's not. I don't typically see kids that like they'll come in and they'll say, you know, oh, my son does this and this and this, and it's just like any sibling relationship. And I know in this situation it's not a sibling relationship, but other kids, sometimes they pick things up from other kids, but I don't like. This is
Yeah, and because
it's too
Kim,
hard to say, and
and
you know.
Kim, you weren't able to see if he knows how to chew, right?
Right,
So
no, I
that's-
wasn't.
That
Right.
you don't learn from someone else. That's you
Right.
didn't go through that.
I was
that's
more
a
so
lot of
talking about
hard-
like the holding.
Yeah,
The
but it
holding
could be.
more
It
so.
could be again because
Right.
feeding is so complex between behavioral, developmental, and environment, right? So that's That's why it's so hard to answer that question, and I don't think anybody will be able to tell you yes or no.
That's fine. Okay, so one of my questions is, because I've reviewed a lot of like all the paperwork from all the doctors he's involved in, and nowhere does he have any of his family history on it. Why come he doesn't have any, like, if so, where is the family history?
It should be there
Because on the gastro, like all those papers of Dr. Paloma, it says 0 family history. So I mean,
Yeah.
as someone that's so young and has a lot of issues, it'd be important to know like what his dad had, what I had, like what our parents had. I mean, I would say that that's pretty important considering like anything dietary.
Yeah.
Any of those
I
things.
cannot comment on that because I didn't go back on his notes, but usually it's the medical assistant that sits with you guys before when she rooms them. whether he was room with foster care with you guys, they ask those family questions. So they live somewhere in the chart. They may not be translated into Dr. Palomo's note per se, but they should be somewhere in his chart.
Okay.
But I didn't check his chart per se.
Right.
And depending on what the medical assistant ended up getting from foster mom or from you guys, that's what gets put in.
Okay. And did any of his doctors review any of his primary care physician notes? Like any of those? Did any?
I didn't. I'm sure Dr. Palomo.
Okay.
Dr. Palomo said he had an extensive discussion with everyone involved with OBA from the get-go. I don't know if he was talking about primary care or Arnold Palmer. That part I cannot comment on. Is his primary care part of us, or is there a specific reason why you're asking about primary care? Does he have?
He's not. They're not a part of. He has a different one now. So.
Yeah. Okay. Is it because you were worried about something? Or
I was
you
just
were
wondering
worried
because
about
like the
something?
connections, like the miscommunications.
They typically, so whoever the primary care on his chart, it gets all our records. So his primary care physician will get his discharge letters from whenever he's hospitalized, the ER notes and Dr. Palomo's notes. They always are signed and faxed to the PCP. So the primary will definitely have our notes. Vice versa, I typically not unless they have a concern and they send to us.
Okay. When was he, I don't know if he was, or I'm just going to say when was he diagnosed with malabsorption or maldigestion?
Do you have an answer to that, Amy?
So I think it was put on the chart only to help get the Pediasure peptide covered, not that it was necessarily diagnosed with it. So, because that was again kind of placed on him.
I can't hear her.
I think we just
She's on the phone, Dad.
getting it covered, but I don't think he's actually diagnosed with that.
Okay.
So Dad, she's on the phone, but mostly,
Hold on.
she's on the phone, that's why you can't hear her, but mostly, the reason we put it is for WIC to approve it. So the reason for peptide, the insurance will come and tell you, or why you're giving this child peptide and not regular Pediasure, and more often it's put in the chart to justify the use of peptide, not because we think he has a malabsorption problem.
I didn't get that.
So he's not diagnosed with it. The only reason they had to put it was so it could be.
Gotcha. So when they did the Creon experiment, they ruled it out, and so they put it back on paperwork to get him on peptide.
That Creon is Arnold Palmer, right?
Yes.
I don't know what happened in Arnold Palmer, so I cannot comment on Arnold Palmer and the malabsorption of the Creon there.
That's the gastrologist, Dr.
Right.
Hadid.
Yeah.
Okay.
So I don't know what, I will leave that question to Dr. Palomo, he likely knows. Yes, if you're putting Creon, you have a malabsorption, lack of digestion issue.
So this is the surgeon?
No, I think you're head of the gastrologist department?
No,
or
I'm the head of the feeding clinic.
head of the feeding clinic.
So Dr. Palomo should have told you about
okay.
me, because I run the feeding clinic and so on, but I don't know what happened in Arnold Palmer. So if he was on Creon, he would have a malabsorption issue, right? But like if he's not on Creon anymore,
They
then he's
took
absorbed.
him off of Creon. So honestly, you basically don't know much about my child at all.
I know what's in my chart, but I don't know what happened in Arnold Palmer, no.
Okay.
Okay.
Because I'm only involved with feeding, right? I'm only involved with OBA with feeding. That's why I cannot answer some of your questions, and I don't think they're relevant to the feeding clinic today. Does that make sense?
The malabsorption, I think, would be relevant to feeding and allergies, but that's me.
No. Feeding clinic has to do with chewing and swallowing, not with absorbing your nutrients. I think that's what the disconnect is.
All right, so let's move on. My next question is why, it's kind of more for like nutrition because she kind of talks to Paloma a little bit more. Why was an allergy test never performed?
So generally with his age, allergy testing could be a little tricky and lots of false positives and not necessarily actual allergies depending on how you're testing. So we generally use reactions to things, vomiting or distension or other rashes as our clue that we have an allergy, and then we test later when it's a little bit more conclusive.
I can understand where you're coming from, but my daughter was tested for allergies at 4 months in this hospital, and they know of her allergies. So, and when I got the allergy test, the doctor asked me, I think it was Steven something, I can't remember his last name. asked me about the other child, but he said that it would be better for them to get tested at an earlier age rather than wait till they're 2. So basically, I mean,
It depends on what allergy you're talking about. So there's GI allergy that you cannot test for blood or skin test. And
Okay.
there's regular allergy that you test for blood and skin test. So if you're worried about a food allergy that triggers hives, triggers asthma, triggers difficulty swallowing, yes, you can test for that blood or skin, and it would be significant for a child's age. But if you're taking about a GI allergy that leads to lack of absorption or lack of or intolerance, that you often cannot check with blood or skin test because it's a different type of allergy.
Right.
It uses different cells, so you cannot test for. So it depends on where your question is
I'm
heading.
more wondering about like just normal.
He's on allergy medicine.
No,
He's not,
allergies.
has no allergies.
Yeah, I don't know about the citrazine. I cannot say who put him on the citrazine.
Mhm.
I looked in the chart and it doesn't have a physician's name attached to it, so I don't know who prescribed the citrazine.
Okay.
And anybody can refill that. Can anybody pretty much refill an allergy test?
Can
anyone refer to allergy testing?
So the
So what
nutritionist,
kind of allergy
Yeah,
are you
and
worried
PCP.
about? Like
Um,
the YP and citrazine, like environmental allergies?
I kind of want to.
Because citrazine is for environmental allergies.
Yes, ma'am.
Okay. yeah.
Environmental. I'm
That
trying to
would be
think because
his-
my daughter got environmental. She got milk protein. She got
Uh-huh.
all the normal allergies that a child gets. That's what we wanted done for our son, and we've been asking for months and months and months. Yet no one has done it.
So that's a question for his pediatrician to send to the allergist if you're worried about
Correct. That's what
environmental.
we're working on now. I just wanted to ask like
Yeah,
why
so
it was
I
never
would-
done
yeah.
mainly.
But from a GI intolerance, that's a hard one. That's a hard one to test for.
Okay. Now, is actual food allowed to go through the tube? So, are you allowed to do, blenderized tube feeding?
No, because it's very thin. It's going
They don't
Okay.
suggest it.
It's too thin. The tube is too small to do it.
If it was a G tube, yes, but
No,
that
that's
tube is
not.
going to clog.
That's their practice. That's not truth.
Huh?
I've known people that have NG tubes and they get BTFs.
Yeah. It depends on the thickness of the tube.
When you look at his
That's a
tube, that's in,
nutritionist, dietitian.
that if you have a bigger size tube, of course. If you're talking about 12 or 14 French, of course. When you look at your son's tube, it's 6 to 8 French. Anything will clog. The pump cannot put it. The syringe will not. That tube is going to clog if you put blenderized diet inside.
Gotcha. So, bigger tube. Gotcha.
Hold on one second.
The noisemaker, I love it.
I tried to put the towel there to think it would help, but
And it fell off.
Oh, it fell off. Oh,
Yeah.
it fell off.
It's soft, yeah.
Okay, now I only have 2 more questions. Unless.
Is this, hold on. Is the size of his tube for an infant or a toddler?
No, that it's actually suitable for his nose. That's the infant toddler size. If you
So
go
it's the
bigger,
same
it's
size
going
for
to
an
be
infant and a
stiffer.
toddler.
If you go bigger, it's going to be stiffer. We usually, like our practice doesn't recommend blenderized diet through a feeding tube. We recommend it through a G tube, but not a nasogastric tube, just because it's a longer tube, it gets clogged, then you have to change it so often. So that's why we don't recommend it.
Now, okay, so why did Dr. Palomo wait months before he even discussed getting the NG tube taken out and replaced with a G tube when he said that it's only supposed to be there for 6 weeks?
So that's a question for Dr. Palomo. I can
Okay.
answer on his behalf. Yeah.
Yeah, he wasn't
Neither
supposed
can
to be
Amy.
there.
To what?
I thought he was supposed to be there today.
No.
Okay,
So, hold on. Let me get one more question.
Okay.
So, the appointment today is only for feeding,
Correct.
not a surgical conference, right?
No,
Right.
this is a feeding. The feeding clinic is run by myself, which I'm the gastroenterologist, run by Amy, and
Right.
a therapist. Today you have Kim because she knows Olga from before, but that's how the feeding clinic is run. So we're the
Yeah, my
team.
question was, today was just for feeding, not for a surgery consultation.
because we were told otherwise.
No,
Yeah, we were told it was for a surgery consultation. Palomo and a surgery, all these people would be there, and not even half of them are there.
no.
That's not
Who,
confusing.
who mentioned that to you?
The state, a whole bunch of people. We have it on record, and we can prove it. I just want to get past that.
No, that's okay. You don't have to prove it. I just want to make sure where you got the information from, because when
From the
our
state,
staff,
our case
yeah.
manager, and from Respite Care, because Respite Care actually set up this appointment for what it seems like called our paperwork, because she couldn't get him
no, Kim set up this appointment after Dr. Palomo talked to us.
Yeah, I set up
Yeah,
this
that's what I'm
appointment with Danielle when he was still in her care, and she said
Yeah.
that she would let you all know, and then I got the Mind and Moore's message from Mom stating that Ova had been transitioned 100% to your care. So
Right.
yeah,
But you got the call from Palomo, right?
I'm sorry.
You got the call from Palomo?
When we got the referral from Palomo.
Yes.
Yes, that's what I mean. So the original respite foster mom, not Danielle, her name is Julie Cayley. She is the one that was setting up this appointment. I have the paperwork to prove it. And
No,
Palomo
I didn't speak with her.
Yeah, I know,
There's
that's
a
what I'm
note in
saying.
this chart where I spoke with Danielle to set up this appointment.
Yeah. Either way, we're going to come see you anyways, Kim, because you're
Yeah,
very
I'm like,
important.
I called to make the appointment.
Okay, so basically a couple of the questions I have to ask are you can't answer them because the people we were informed were going to be here aren't here, so I'm not even going to waste anybody's time.
Someone call Palomo?
He's actually on call today, so he's running on the inpatient service. So I would say
Okay.
maybe send him a Mind and Moore's message and then let him know that you guys had questions for him.
Well,
Okay.
actually, don't too much. Well, you go ahead, baby.
So this is more for the feeding, and I already asked that. Just kidding. Scratch that. So why wouldn't Dr. Palomo or his office train me to do the NG2 feeding, the NG2 placements when he trained foster mother?
I don't know about that. Again, like that.
Do they do that there?
In our clinic?
Yes.
So our policy for our patients, most often we tend to replace them ourselves. We rarely teach the parents.
So you do?
Huh?
So you do teach them?
No, we usually tell them
Rarely.
to come. Huh? We
You said
rarely, like, the only parents I taught myself, it was a teenage kid with a different that he wanted to put it in and out himself. But our
Okay.
policy is to bring you here and replace it because you need to make sure it's in the right placement and so on. So I know other hospitals do it before you get discharged from the hospital. Let me teach you if the NG comes out so you can replace it, but we don't have this here. So I don't know.
That's I mean, I can go somewhere else to get trained. It was just a question because I know foster mom was trained by this hospital and
By Nemours?
Yeah.
Oh, that
and then they refused to train me. So I don't know if it was some real
No,
reason.
we don't, again, because you cannot do an x-ray, you cannot check.
But they
the
have,
placement
correct.
at all.
But I actually spoke with the lady that actually replaced it on August 20th, and she said they have these strips that you have.
Yeah.
And that's what they used when they replaced it the second time at a different hospital. They take the strip and they
check for acidity.
test.
Yeah.
Correct. So that's what they give. The people can buy on their own. But my last question is, why did Dr. Palomo call DCF on us?
Again, I am not Dr. Palomo, I don't know what happened with you guys and Dr. Palomo in the past, and please don't put me in this situation.
No, I'm not. I'm
so I
just
don't
saying
know.
that
Again, we here.
I don't know if it was he was told to do it or if it was to set us up, but regardless of that, all I can say is we won't further be seeing Dr. Palomo. I already have him set up for a different GI. Do what? Yeah, no doctor except for Kim is who we are going to be seeing here anymore because that's who it's the only person I feel comfortable seeing.
So
and I
that poses a bit of a problem.
Exactly, yeah.
Because with our feeding team, we work closely with the GI and the nutrition to make decisions moving forward. It's a team approach. So yes, you see me for therapy, but if I have concerns, like for example, with the holding of food, if we come in and we're continuing to progress through therapy and he's doing well, he's accepting, but we're still seeing this holding, and I have concerns that maybe there's some other medical thing going on that's causing him to not want to swallow. I then take that concern to Dr. Haddad, who conferences with Dr. Palomo and, figure out from a medical standpoint, are there some other things that we need to look at and look forward with? So I need that team approach. If he has a GI at an outside provider, I don't have that ability to communicate with them. And so,
And our feeding program only sees internal patients.
Correct.
We don't see external patient yet.
we only see patients
So
that are
internal meaning
sent to us
managed
from
by-
our GI practice.
Okay.
Because of the high wait list that we have and things like that. So that's where, if he's going to be seeing a GI outside of Nemours, I can make recommendations. I have other friends in the community that do feeding therapy and things like that, but I apologize, I'm not able to see kids outside of our practice.
Okay. Do you have anything to comment on that? Yeah.
I don't know. We'll see how it goes. I'm definitely not going to someone that called DCF on me before my child was in my care. That didn't do a lot of things he should have. They didn't fill out the paperwork correctly. A whole bunch of things. Dr. Palomo is not a good doctor. That's my opinion, and that's where I was going.
So, I mean, basically, we
like you, we love you, but
we just don't feel comfortable. It's now a conflict of interest, seeing Dr. Palomo, knowing that he called DCF on us.
That's when he knew he was coming into our care.
Probably.
He was going to shorten a visit, do all these things. We literally have all the paperwork.
So, yeah.
Yeah, so that, like,
What's going there?
that obviously,
And then you just told me, ma'am, you just told me you would have trained someone there, but you want to train us, basically.
say that again?
You said you would train someone there to put an NG tube in. That you guys rarely do it.
So please don't like hammer on words. When we say we rarely do it, I was telling you a teenage patient who put it himself, not a toddler.
Yeah.
We don't have a policy. I don't have guidelines. I don't have my nursing support to teach you guys. So
Right, fine. That's understandable. We'll go to like the CAN. You know, exhaust everything we can do for our child. Try to help our
which
child
is
out.
definitely understandable, right? Like this is your child. Do whatever.
I just
You-
don't feel it's adequate when you guys are open 24/7.
But please don't take it that we're refusing to teach you. We just don't have the policy to do it, right? And when I start thinking about a feeding tube, I just start thinking how long can we keep it in place, right? And so on. So that's a different discussion. But yeah, like I would say, do what you think is best for you guys. But in Nemours, we don't have and Amy could be
But you
my
could write a referral to get that done, though, right?
Say that again.
You could write a referral to get that done for us, right?
Refer where? I don't understand, Dad. What referral do you need me to do? To replace an NG? We don't have policy with Nemours to do that referral. I don't think you're getting the picture.
Gotcha.
Like we don't have, we have a policy at Nemours that the parents don't change the NG tube. I worked at other hospitals in other states that we teach parents to do it. But in Nemours, Orlando, we don't have that policy. Yes, did I teach it to a teenager of mine? Yes. But like for an infant or a toddler, we don't have a policy in place for Nemours, Orlando to replace NG tubes at home. And correct me if I'm wrong, Amy.
Yeah.
Yeah.
Yeah,
And I don't know.
I've seen it been done in older patients.
Right.
That not necessarily in
And I've seen it done in other hospitals. I don't know about Florida. I worked in other states and other hospitals do them, but not Nemours, Orlando, right? I'm just talking about the environment I'm in right now.
Right. You're okay.
Do you have anything else to add?
I thought Palomo was going to be there. Most of my questions for Palomo.
Same.
Playing the drums.
I don't know. Is Kim gonna try to continue feeding, or how are we gonna do that transition if there's a transition? Because we're not going to Palomo, period.
I can't do it if he's not seeing a GI in
Okay.
in.
No, I just don't want to make sure you didn't schedule us up.
No, we hadn't gotten to that point.
No.
Okay. Yeah, we're definitely sorry, Kim, but yeah, we're not going to Palomo.
No, I understand. You have to do what's best. Are you can I ask where are you guys living? I can see if I'm trying to think of if I know anyone that does feeding therapy in the area.
Titusville, Florida.
Titusville. So you'd have to come to Orlando. I don't.
What about early intervention?
Yeah, you could try early intervention. They come to the house. Actually, that's I can get you.
Ability Plus in Melbourne that does really good feeding.
What is it?
Ability Plus.
But does early intervention do it with an NG in place or?
I don't know. They may. Yeah, they may. I'll give you the early intervention. It's a self-referred program. You can contact them yourselves to have the evaluation set up. It's a one-time evaluation at a center, and then they set up the therapy and they come to the house and they will see you there.
Sounds great.
Cool.
So, and would you say Amy Mobilities Plus?
Ability Plus.
Oh, Ability Plus in Melbourne.
It's not in Titusville, but I know they do feeding therapy there.
Hi, where are you going? You're going there? Oh, okay.
I'm trying to think. Yeah. So I will go get you that information. Do you have anything you want to add to the medical part of this? ABS?
I don't think so. I think that the thoughts were the Cape Farms, the trial of the regular Pediasure,
I copied all of that forward from Amy.
and then prolonging the duration of the bolus if he keeps throwing up despite change of formula, basically. That's
Okay.
what we need to do. Yeah, and that should help.
Does
the
any of
mom.
them know where you could get training for the NG tube?
I don't know.
No.
Amy, do you know, like, does Advent Health or Arnold Palmer do it?
I think Arnold Palmer might, but I'm not super familiar.
Okay. The only 3 peds GI that are in the area are us, Advent Health, and APH. So maybe you want to ask Arnold Palmer or Advent.
I would say if you, I don't know who trained foster mom, but it was either
A lot
here
of foster
or
moms, because they have medical background, like especially the foster mom that will take an NG,
no, but she specifically told me she was trained by.
by the Moors.
Yeah, end of day too.
Yeah. Then I don't know. I cannot, again,
You're probably a lie because they lied a lot, but I'm just saying that's what they told us.
Yeah. And a lot of them, especially when they take like they take kids with nasogastric tube, they're kind of a medical foster care. So they all have knowledge with it. But I don't think, were we the ones that put in the NG or Arnold Palmer?
No,
Arnold
I think
Palmer.
we did early on.
We did early.
They probably replaced it.
Okay.
Arnold Palmer was the one that originally placed the NG
Okay,
tube.
so that's could the foster mom have learned there, and she just said us, right? Yeah.
That's cool, yeah.
If the original placement was an Arnold Palmer, they probably told her what to do at the hospital.
She only came here because she got switched to this GI because the original GI wasn't going to release my son in her care.
Oh, so maybe
That's the only reason why she came here.
So she maybe met them at the hospital, and that's how they told her, and then they should transition it to us. Maybe I'm trying to speculate here, but I don't know.
She didn't really. Never mind. I'll just
Yeah.
not comment.
But unfortunately, it's not on our policy.
No additional medical recommendations at this time,
No.
just all nutritional. Okay, perfect. So, Mom, I'm gonna go grab you the information for early steps.
Already been there.
What was that, Dad?
I think he's already been there. Early steps, I think.
Oh, so is he already in their system?
Yeah, he was there. He was doing PT. He just got released, I think.
Yeah.
So maybe
Okay.
they can
Well,
do
but they
feeding.
could then pick him up for feeding therapy.
Yeah.
And where before he may have been doing it,
PT.
yeah, when he was doing the physical therapy, and were they doing it at the foster house?
I don't know because we only been once and we were never invited after that, so I can't really tell you, and we can't even find out the paperwork right now.
Okay, yeah. So I'll give you the number where you can call them, and you can actually say, that my son's been in your system. And they can help get you set up, and you let them know that now you're interested that you have feeding concerns.
Beautiful. Thank you.
Yeah. All right. So I'm gonna go print this out. I'm also gonna give you a copy of.
I think you're good.
I'm gonna give you a copy of this, which is how to obtain copies of the medical records,
Yeah.
because
And the
you may want to take a copy of my evaluation today to them,
Okay.
so that way you can get it.
Right.
And there's a WIC form that Amy printed that should be on the second floor with the GI office. So
Okay.
that will have the regular pediatric.
So I go to the
if you wanna
second
try
floor for it?
Yes,
Okay.
Yeah, and let them know to print.
Yeah, because the WIC office is just waiting for a prescription to put him on so I can buy
Yeah.
with the WIC.
Okay,
And
yeah.
I requested the Cape Farm samples as well that'll be sent to you guys to try out. And
Okay.
see how you
And
like
go to the second floor
I'll
for
be right
that?
back. Yes, no, the Cape Farms will be shipped to your house.
Oh, okay.
But the Pediasure WIC form will be.
Okay.
Will be. But if you like the Cape Farm, then you have to apply through the insurance. If you
Okay.
transition to another GI, ask them to run that through the insurance. But the Pediasure, the WIC form will definitely give. And if he tolerates that better, then perfect. Cool. Do you have any questions for Amy?
Do you have any
My
questions for
phone is
Amy?
going.
No, not that I know. I'm good.
No. All right.
Okay.
For
We're
sure.
good.
Thank you.
Okay.
Because they don't do the BDPF, so it's no big deal.
All right.
All right.
Okay.
Thank you, everybody.
I took you off speaker because there's no one else in here except for
Yeah.
the other lady.
Bye bye. I'm leaving too. Yeah. Bye bye.
Bye. Thank you.
Bye.
No, Kim is printing the paper.